There are lots of things that can help children and young people feel happy and mentally well. Having people who care about them, feeling safe at home, at school and in their community, having somewhere to play, socialise, learn, grow and belong. But life can feel stressful sometimes, at home, at school or even online. So mental health isn't just one person's problem, it matters to us all. In the UK, about 1 in 5 children and young people may have a mental health problem, compared to 2017 when it was 1 in 8. In Liverpool, that could mean more than 28,000 young people aged 8 to 25 are struggling. To understand this better, Liverpool City Council and the NHS in Liverpool have worked with other partners to make a joint strategic needs assessment. They collected information to understand what life's like for babies, children, young people and families living and working in the city. The aim is to find out what children, young people and their families need, what's already helping, what could be better and how can we achieve this. The results show that more young people are struggling with their mental health and some are facing more complex challenges. Since COVID-19, many more have asked for help. Referrals are expected to be almost 75% higher than before the pandemic, and many need ongoing support through multiple appointments. This means services are really busy, and some young people have to wait longer to get the help they need. Boys are more likely to need support when they're younger, but by age 14, it's largely girls who are asking for help. A significant number of those getting help are white and British, which might mean that children from other ethnic backgrounds aren't getting referred to help as often as they need. These patterns aren't just seen in Liverpool, they're similar across the country.
Many young people in Liverpool are dealing with anxiety, depression, self-harm and eating difficulties. Lots of things can affect our mental health. Worrying about money or growing up in poverty, being in care, having special educational needs or differences in how their brain works, sometimes called neurodiversity, or going through difficult experiences when you're young. These are sometimes called adverse childhood experiences. Many of these challenges affect whole families and communities, impacting the well-being of everyone around us. Young people told us that they struggle to sleep because they worry, they feel lonely, skip meals because they're worried about their body or their weight, and that social media can sometimes make them feel worse. If nothing changes, more people might struggle with their mental and physical health in the future. But the JSNA also shows us what's important and can make a difference. Getting help to those who need it most, helping early before things get worse, making support easier to find and access, listening to young people and families, and understanding that some people need extra help. Schools, health services and local groups are already working together to support thousands of young people and families every year, and things are improving. More young people are getting help when they need it and are feeling better. This help is accessed in the community, in education and online. There's training available to support professionals, parents and carers. We're building young people's resilience, and there's support for early years, eating disorders and for those in need of crisis care. The JSNA will help Liverpool plan better support in the future. This means services should work together to make support easier to access, leaders should use the findings to improve services, more support should be available early before problems worsen, extra support should be provided for those facing greater challenges, training, information and technology should be used to improve support, because every child and young person deserves to feel safe, supported and able to thrive.